First things first, let's do a little introductions. Tell me a little bit about yourself and your organization you work for.
Sure. I'm Jackie Rice. I'm the Vice President and Chief Information Officer at Fredrick Health. We're a community hospital of about 269 beds with about 26 ambulatory locations and a cancer center.
I'm Jem Ford. I am the Manager of Product Management, Clinical Product Management at MEDITECH.
Excellent. Let's talk about the partnership between the two organizations. I know it dates back several years. Can you talk about?
We have had MEDITECH at our organization for over 20 years. We've been good partners. MEDITECH has been a partner with them, and we have grown all along. MEDITECH has grown, and we have grown and had great results.
Jen, what's it like having a partner who's willing to kind of be your guinea pig maybe sometimes, but also kind of try out some new things? How important is that symbiotic relationship?
It's wonderful. Fredrick is so forward-thinking that they're ready to jump on the bandwagon with anything new that we might bring. This whole idea of precision medicine and jumping into a new realm that hasn't really been done before. It's really great to have somebody to work with who is always forward-thinking, but also willing to give feedback and help us drive our products forward.
Excellent. Let's talk about precision medicine. This was I remember when the term first came out, it was about a handful of years ago. It seemed like a moonshot type of mentality, but what does it really mean to do precision medicine from a provider standpoint?
From our hospital organization standpoint, our job is to take care of the patients in our community in the best way we can to the individual patient. We've been doing vital signs for years and imaging, and we'll have your labs. The next thing that is going to be a standard is your genetic information so that we can better treat you individually. So we need that genetic information to do that. It started out being very, very expensive, moonshot as you said.
Yeah.
It's becoming much more affordable. And what we need are the payers to jump on and pay for this. But it is the right thing to do for our patients to treat them for their individual plan of care.
And then from a technology standpoint, genomics obviously takes up a lot of data. I imagine there's performance and reliability types of things. What's it like to bring genomics into the clinical space?
It's been quite an effort. I've been working on this for almost 8 years at this point, and it's a global effort. It's not just in the United States, it's not just in this area, and it's really about working across the globe, working with all of the companies that are involved, and figuring out the right format to exchange data. And once that's done, figuring out within the EHR how we leverage that data to actually bring real-life clinical decision support. And that's what precision medicine is to me. It's not just having the information, it's being able to leverage it so that when the provider's at that point of, what therapy do I use next? I'm prescribing this med, what do I do? Having that stopgap right there when it's happening to say, look in this direction, go a different direction. Your patient that you're treating, it's not the right thing to treat them with.
So obviously change management is a big deal, any type of technology in a healthcare environment. Do you face any kind of obstacles when it comes to putting precision medicine kind of into action?
Sure. Nobody likes to change their workflow, right? But it is all about that. We've actually made some very positive changes. Oncology has used genetic information for a long time. So they are saving time on orders, putting in orders where before they would have to go out to a portal. They couldn't do it within the EMR. They had to go out to a portal. You can save 30, 25 minutes doing that. And then if you are looking at the data, if you're a provider, you get a PDF that's like this that we scan in, and you have to go find it and go through it. If you're the oncologist, I've seen them print it out and highlight it. I can give that to them and save 25 to 35 minutes in a visit for them in time savings, so they can see that data and treat the patient more precisely.
I know with oncology, that's to your point, a lot of genetic understanding.
Yeah.
What are the other use cases where you can think of as we'll get into something like primary care, more preventive care?
Absolutely. You're going to be sorry you asked me. No, we do. We have brought it forward, and we're doing pharmacogenomics. So But when you take that, if you talk about challenges, when you take that to a provider who's going to see a patient for 13 minutes and you tell them, I'm going to give you this genetic information, they're like, I can't do anything with that in 13 minutes. But if I can bring the data in and give clinical decision support, so when they go to order a med, it flashes and says, there's an interaction here with this patient's gene. And we keep that information updated because it's growing. The information is growing every week. So we update it. So if I can put that information right there for the behavioral health providers and the primary care providers, cardiology, even surgeons, those are a lot of areas. But you're right. It's at first people are like, they had what, two genomics classes when they were in school. But if we have, it's our job, MEDITECH, and my job as the CIO to put that information in front of them to make the best decisions.
And with technology, how important is it to work directly with these clinicians to understand what they need, what they want, how they want it? I imagine no two physicians or clinicians are alike, but you need to standardize certain things. I'm curious what the challenge is in ensuring that there's that adoption and also that really meaningful use of the technology.
It's definitely no two clinicians are the same. I will say that, and especially in something like this, it's in every software that you create for the clinicians and in a clinical setting for use where it's so important that you're treating the patient, there's always talking to many different users in all areas to make sure that they like the design, it's intuitive, they can understand where they go next, and they want to use it in order to help them. But when you become to genomics and precision medicine, it's even more challenging because it's such an unknown world, that, as Jackie was mentioning, that it's even harder to give feedback on because they may not necessarily be aware of what it's capable of and what they want. So you're designing to the future, as you were talking about, and saying, listen, we're going to design this and we're going to try and take your input and then putting it into action and seeing how it's used and continuing to model and make it the best it can be.
Jackie, how transformative do you think it's going to be? To me, this is like when we get into genetics, we've obviously discovered a lot of things that we didn't know were impacting how, we talk about your zip code and your genetic code as those two kind of driving factors in your life. But the speed of research and innovation now is absurd.
That's why it's important to build something that you can update all the time, and that you're going to be able, if you do a pharmacogenomics test on me today, I want that information in there, but if I come again in 2 years and a medication is ordered, we need to have that updated. So you need to be forward thinking with the technology that it's going to keep up with all these changes, because I think it's going to be a standard that we use genetic information to do your treatment, but we also have to be facile enough so that we are ready to accept the new information coming in, which MEDITECH has really thought through and is helping us put in place.
And I want to ask you about how flexible and agile technology has to be, because you don't really know exactly what you need until you need it, and you want to stay ahead, but I imagine you're building the track or the railroad, the track as you go. So what's it like kind of being in this new world?
It's been an adventure. It's not you're only just building the track before the train is built, but you're building, the next spaceship before it even comes to fruition. And I think we've been very lucky to have partners like Fredrick Health who are keeping us in the loop on what their plans are and what their goals are, as well as watching the industry to be able to develop these things ahead. But it is a challenge, but we've also worked with fantastic partners who are helping us with the content and keeping that updated weekly for our customers, so that we can do the job of delivering the information to the clinician in the right way when they need it, and we don't have to necessarily worry as the electronic health record of trying to keep on top of what clinical trials are coming next. We have people helping us with that too.
And the first iteration is not always what you're going to have at the end, right? It's very important to get that feedback from the providers and those people supporting the providers. Give it back to MEDITECH, make changes. So what you start off with is not what you're always going to have. It's an iterative process.
I wanted to ask you about real world evidence and actually one of the problems with clinical trials is you're working in a tightly controlled environment, but then you get into the wider population, then the reality starts kicking in. It impacts certain people different ways. Do you feel in kind of making this step that you are contributing to better medical research?
We are partnering with NIH. We have some partnerships with Johns Hopkins. And yes, I think all this data out there, and when we figure out how to harness AI, we are going to, the information that we have is going to grow at a very great rate.
Excellent. And then this last question is, in terms of a lot of the infrastructure components, why taking that cloud and kind of SaaS approach is so important to, in plain language, keeping a door open for what you just don't know and kind of being ready for what's next, even though it might not be clear.
Right. I think the SaaS model, in our case, MAS, is a very important functionality of this, because what the most important thing is, and people have asked me this before, what do you think it's really going to take to get precision medicine going? And we know that the academic hospitals have been working in this space for a number of time, and we're ready to support, and we do support them as well. But most of the care is transitioning to the community, and it's going to need to be the community hospitals that are really taking the lead on this, like Fredrick, and pushing it forward. So being able to have a system that is flexible and scalable to be able to work in that setting with minimal upkeep from the hospital side of things, it just brings a whole new level of opportunity, and that's what we're excited about.
It's about time community hospitals got a little love, right?
Yes, absolutely. A lot of love.
Well, thank you so much, guys. I really appreciate your time. Thanks for joining us.
Thank you.
You.